Coming up on American Medicine Today, those affected by cancer are well aware of the struggles faced while fighting for recovery. Elizabeth Benedict chronicles her amazing journey in a new book, Rewriting Illness. Then, Mark's back pain prevented him from standing for long hours working as a chef. After the Bonati Spine Procedures, Mark is back to work and spending quality time with family. Finally, Dr. Bonati highlights some of the latest advancements in spine-related technology, including implementation of computer-brain interfaces. Hear about the incredible technology that's allowing the formerly paralyzed to walk again. Coming up on American Medicine Today.
Featuring cutting-edge science and medical innovation, touching personal stories of recovery from pain, along with political, social, and healthcare issues plaguing our nation. This is American Medicine Today, brought to you by the Bonati Spine Institute and Alfred Bonati, MD.
Welcome to American Medicine Today. I'm Kimberly Bonati alongside Ethan Youker and world-renowned orthopedic surgeon Dr. Alfred Bonati. So what happens when a novelist with a razor-sharp wit and lifelong fear of illness suddenly discovers a lump where no lump should be? The result is a wickedly funny memoir from author and cancer survivor Elizabeth Benedict. Thank you for joining us, Elizabeth.
Thank you for having me.
So the book is called Rewriting Illness. Why don't you tell us about your life as a successful novelist before finding evidence of tumors?
I was writing my sixth novel when I discovered this unexpected event, and I started to wonder about this little sensation I'd had in my armpit that I'd felt for several weeks, and it was very vague, which is why I'd never looked into it before. It didn't hurt, and it sort of came and went. And I very gently put my hand into my armpit, and it was as though I'd put my finger in a light socket, and there was a lump in there. And I think women are often afraid of feeling things like that because we do self-breast exams and we get mammograms regularly. But there was this lump of the sort I'd always feared I might find in my breast. But it was a few inches away.
Were you immediately panicked as someone who had as you said, a lifelong fear of illness? When you find that lump, what's running through your head?
Well, I was immediately alarmed. And I screwed up my courage to go online, which I knew was also somewhat dangerous. And I learned that it could be one of three things: a swollen lymph node, evidence of breast cancer that had not yet gone to my breast, or some kind of blood disorder, blood disease like lymphoma. And so I knew that there was a chance that this was not great news. But the idea that it could be a swollen lymph node was uppermost. And of course, I hoped it was that. I went to the doctor immediately. As soon as I got up in the morning, I called the doctor, and I was in her office several hours later. And she said, "I think it's a swollen lymph node. It's huge, and let's get it looked at." I went to a radiologist 2 days later who said, "It's two swollen lymph nodes. It looks like some swollen lymph nodes, but come back in 2 weeks if it hasn't gone away." And when I tried to go back in 2 weeks, my doctor refused to give me a prescription, and she wanted to get more tests and more sonograms. And the radiologist had wanted me to get a biopsy or a PET scan at that point. And that was sort of the beginning of the difficulties I encountered. And I had other symptoms by then, and no one was taking my symptoms very seriously. And they were kind of making me go to other doctors about other symptoms. And my doctors, who happened to be all women, kept telling me how concerned they were about my anxiety, which I found deeply offensive and beside the point.
Correct. You weren't being heard for your very serious symptoms. What type of treatments were you taking? I mean, natural remedies, some were debilitating treatments, correct?
Well, when I was told it was a swollen lymph node, I took a lot of natural remedies that are used when you are trying to shrink your lymph nodes. So those are the things I did, but I did them for about a month because nobody was diagnosing me. And I did jumping jacks, and I drank Bragg apple cider, and I drank turmeric tea. and I drank wheatgrass juice. And those were, again, all things that kind of boost your immune system and help with lymph nodes, but none of them was having an effect on my lymph node. And I was also getting tested for other things, and doctors were doing blood tests. And so it was 6 weeks of real, incredibly intense anxiety before a doctor even said, let's biopsy this. And then that led to other delays and postponements, and then summer vacations, and then doctors telling me that one doctor said he thought I did have lymphoma, and then his colleague across the street said, well, maybe not, and let's do another biopsy, but I'm going on vacation. And it was just a series of what I call do-it-yourself medicine, where I had to go from one doctor to another, and there wasn't much good communication, and there were a lot of things that fell through the cracks, even though I was very vigilant about my health. And I was a bit of a hypochondriac. So I really was very concerned. And I was doing everything I thought I should be doing, but I had to sort of make everything up as I went.
Sometimes being a hypochondriac is actually a good thing, because, if you're insistent that something truly is wrong, even if you're being told, second opinion, third opinion, whatever, that, don't worry about it. But you are convinced that something's wrong. You keep going. So the book talks about your medical mishaps, doctors who don't get it, debilitating treatments. None of that worked. And then apparently you found yourself a cancer guru. Tell us about that.
Well, what I eventually did, I had a friend who had breast cancer 40 years before, and she gave me a lot of advice. But I eventually did get this not swollen lymph node biopsied, and it was lymphoma. That was 3 months after I found that lymph node. And so I was given the name of the treatment director at this major New York hospital. So I called him right away, and I was told his next appointment was in 2 months, even though I'd been a patient in the hospital for 2 months already. And I hung up, and I had the name of another doctor that a friend had given me who had treated her mother many years before. And I called him up with no preamble, no contact. And he called me that night, and he had me read the pathology report, and he gave me a list of instructions of what I needed to do and the tests I needed to get so he could treat me. And he said at the end of the call, I'll call you tomorrow night, and here's my cell phone number. So I went from doctors who were sort of going on vacation to a doctor who was more attentive than my best friend. And he turned out to be, he was one of the world's leading experts in lymphoma. And he became my doctor, and really just by chance.
Can you sort of encapsulate and summarize your journey back to recovery and what led you to rewriting illness?
I had the good fortune to have a chemotherapy under the care of this wonderful doctor, and then radiation. And we waited for 2 years to see whether the cancer recurred. It did not recur. It's been 5 years since it has not recurred. So I am in very good shape. I feel very fortunate. I'm a writer. I've written 8 books, and I write a lot about my own experience. I write about things that are confusing that I'm trying to figure out, trying to make sense of. And I began writing the story of what happened to me with all of these sort of twists and turns and the fear I felt. And oftentimes my own fear would keep me from asking too many questions because I was afraid of the answers. It wasn't just about the imperfect medical system, but it was about my own sort of failings as a patient, even though I was in many ways a good patient, an attentive patient. So I had a lot to write about. I had a lot to share with people.
And not only that, but it also helped you. I'm sure the process was quite cathartic. Mm.
Yeah, it was. It really was. It really helped me put my thoughts together and make sense of all the delays and the misdiagnoses and the missteps that doctors made, and a few that I made too. So I try to hold myself accountable. And I also try to infuse my story with enough humor so that I like to say it's entertaining to read. No cancer story is entertaining.
But you wouldn't think so, no.
I think it's a suspense story.
Okay.
And I have a lot of I mock my own humor and my own excesses, and I try to, make the reader feel that I can see myself more clearly now than I saw myself then.
And Elizabeth Benedict, thank you for being on the program. This is amazing, and thank you for being an inspiration to others that are going through the same thing that you went through.
Thank you for having me. It's really an honor.
Make sure you stay tuned. Coming up, a story of recovery.
I went to Dr. Bonati and he went ahead and looked at my pictures. He told me, you have pain here, you have pain here. And I was like, yeah, absolutely. I'd been to others, but he was a doctor that didn't want to fillet my back open like a fish and do like open spine surgery because everybody else wanted to do that and I was not having it. The anesthesiologist who was working with me, I was like having a conversation with this guy, and then I was watching on the monitor as Dr. Bonati is fixing my back. I really felt like I was in good hands.
Visit askbonati.com. Mark Saylor is head chef for a retirement community in Dunedin, Florida.
I'm a chef, so I'm on my feet constantly. It's 10-hour days, so anyone that's in this business working on the line is on their feet for 9-10 hours straight. There's really no sitting time, so it's a lot of strain on your feet, which tie into that back pain, I think.
His career is physically demanding, requiring him to bend frequently, lift heavy objects throughout the day, and stand for long hours. After working this way for years and coupled with accidents that affected both his Achilles tendons, Mark's body was telling him enough was enough.
My pain probably started about 15 years ago, I think. I had an accident with my left Achilles. It seemed that having to be non-weight bearing on that, it seemed to cause problems in my lower back. And then I let that go for several years, and eventually I ruptured my other Achilles, and I think that tied into more back pain that I was having. My pain felt like a sharp stabbing pain, sent like an electric pulse down my leg, and my toes would often go numb. Almost felt like a knife in the lower back.
Eventually, the pain prevented Mark from spending precious quality time with his wife and children.
Pain affected me in the ways of I couldn't take the walks with my wife, couldn't do things with my kids. It was hard to even go shopping. I mean, I was always that guy hunched over on the shopping cart walking around the store. Couldn't even hold my daughter in line. I remember being at Disney and couldn't even pick her up and hold her for more than 3-4 minutes without the pain.
Working became almost impossible for Mark. In an attempt to resolve his pain, he tried conservative treatments, including chiropractic care, massage therapy, and pain medications. This approach only masked his pain and never provided him with lasting relief.
Work was agonizing. It was tough. I got to the point where I almost wanted to try and file for a disability, but it was you work on the line and you're standing, so every time there wasn't a ticket, you'd kind of kneel down to the ground and try and relieve some of that stress. So it was painful. I mean, there was times when it was just agonizing to even get out of bed, or it hurt too much to walk, to get in the car and drive, and then when you went to get out, the pain was there in your lower back. I finally got to the point where my pain was just agonizing, and I was at the very end, and it was either file for disability and stay at home and just live with the pain, or go through with something that I've seen commercials and I've heard about other people doing it, and it was just kind of a life-changing choice for me.
After hearing about stories of other people's successful Bonati Spine procedures on television and radio, he contacted the Bonati Spine Institute for an appointment.
The doctor care was great. They took me right in. There was no wait. They took the x-rays. They took the MRI. The consult was immediate, and it was with Dr. Bonati himself. And we discussed he knew right from just where my pain was. He looked at the MRI, and then he kind of looked at me and said, "This is where your pain is," and it was exactly what I has experienced. So I thought that was neat. He knew right where the surgery needed to be.
The exclusive Bonati Spine procedures are performed using conscious IV sedation.
And what that involves is, this is all intravenous, and we use a combination of several different medications, so that way it presents for a much smoother experience for the patient. So the entire benefit of doing the procedure this way is that way the patient is alert and talking and able to pinpoint exactly where the problem is to the surgeon while they're on the table. Shorter recovery time, less pain when they're done. Obviously, the whole idea is to get them pain-free. And we're able to know right away while they're on the table. Secondly, they're not going to get general anesthesia, so they won't have any kind of prolonged post-op recovery.
He had one targeted Bonati Spine procedure in October 2015. Mark knew while he was in the recovery room shortly after surgery, his pain was eliminated.
It was L5 in the spine, so it was I had a laminectomy and a discectomy, so I was able to alleviate all that nerve pain. Pain was gone in the recovery room, and told me to get up and walk down the hall, and I could feel the pain was gone. Within 3 days, I was ready to go back to work. It was, within a week, I was back to my normal self. I was just watching the weight restriction. I felt like I could already lift 50 pounds, even though, they keep you at a very minimal. But the recovery was fast, and within 3 months, I was back to full playing sports and everything I loved.
Now pain-free, Mark is back to spending time with his family, playing his favorite sports, and enjoying his time in the kitchen again.
It's been great. I've been able to do all the things with my wife and family since. I've been able to do the sports that I love, things that I was ready to give up on. Everything from tennis to kayak, softball, basketball, everything. I mean, it's just brought me back to doing everything that I wasn't able to do in the past. Yeah, work is fantastic. Like I said, it's a long, days are long, so you can do 10 to 12 hour days, but I don't feel that pain anymore to where I would even just want to go home from the pain. So currently I just love my job. I love working. I love, the whole atmosphere now.
With more than 75,000 successful procedures performed with 98.75% patient-reported satisfaction, the experience at the Bonati Spine Institute is unlike anything you'll receive at any other facility. Patient advocates provide personal attention to patient care in every step of the process, and you can contact your surgeon with any questions you may have before, during, and after your procedure.
I went through 10 years of fear to get the pain alleviated. I felt no pain. My life's completely changed. I feel like I had wasted 10 years not doing it, and to do something where, I guess the biggest fear is it's a back surgery. They're near your spine. You get that worry that you're gonna wake up and not feel your legs, but that's not there. And I'd recommend that to everybody. It's a great surgery. I've been to a couple other institutes around town, and just in the fear of getting the process done, the whole insurance process was faster. The way they treated you when you walked in the door right away was better. He's just, he's got it right, so it's very comfortable when you're in there by everyone that you meet. I would highly recommend Bonati to anybody, yeah.
I think everybody was shocked, like, really, you had surgery today? I had a drain tube. I was at my desk doing payroll for 200 employees, worked till night, got up, went to bed.
Actually, the recovery was great. I mean, I really immediately felt the difference. I was able to go back to work within a couple of days.
The progress after each procedure was amazingly good. The recovery, all told, has been phenomenal.
We went to the Bonati Institute, and that was the turning point in my life. This type of surgery is so much more advanced, and the recovery time is so much less that it's just a no-brainer. If you've got pain, go to Bonati.
The surgeries that I had, actually, I recovered very easily from, I would say. I actually went to work the following afternoon.
That afternoon, when it was done, I actually felt so much better already.
6 days after surgery, I was back in the gym, slowly but surely working my way back to fighting, back to basically 100% of fighting. So 6 days, and everybody wasn't all like, didn't you just get out of surgery? I'm like, yeah, I feel great. I was rolling with everybody, and I'm in the advanced class, so that sounds a lot right there.
First time I came in here was Monday, and today is Thursday. I've had 2 surgeries and am doing fantastic. I'm still in shock that I can walk. That's all within 4 days.
Bonati succeeds where others fail. Welcome back to American Medicine Today. So, Doc, there's some incredible technology being done between computer-brain interfaces and those that are paralyzed, where it's getting them up and walking. Is that correct?
It's a type of a new advance that was done in Switzerland. This is probably one of the most advanced situations that we ever had in paralyzed people.
Okay, and why is that?
What they did is they used some type of a bypass, like a bridge, and it's being called the BSI, Brain Spine Interface. They put that bridge that gets directly the implant on the brain, and they transfer information that is going to cross the area where the damage on the spinal cord was created. And the information from there is going to get the information from the brain directly through the bypass to the spinal cord.
Is there anything different about the way that it's hitting the spine than previous computer-brain interfaces that have helped the paralyzed walk?
Well, this one is the very first time that they make the people walk totally normal. Before, there were some type of experiments that they used trying to mobilize the legs. What they did is locate through a computerized system exactly the areas of the motor located on the brain that they will mobilize the extremities.
Right.
Then they create different areas to mobilize the hips, the knees, the ankles, and all this was then organized in a certain way that the people will be able to mentally get the information, but the information initially was very rough. They need to practically trigger different types of power, so the person, if you say stand up, is not going to jump.
Correct.
Okay? So, or you say move your hip and the patient start to run, something like that.
Sure.
Well, I'm exaggerating what I'm saying, but I'm trying to give you an impression that they need to modulate this one in a certain way that is very soft, so it looks like a normal walking, and is done by the mind. But the mind gives the information, the computer regulates that, and then gives the information of the bypass to the spinal cord, and then the spinal cord makes the motion.
Is this device something that needs to remain inside the body?
Yes, it's a small type of a let's call it small computer,
right,
that they put directly on the brain, and to do that they need to do a craniotomy, and then they get inside exactly where they need to put this tool there. Now, you need to understand that the damage on the spinal cord can be at different levels. Can be not only at different levels, but at the same time, it can be different types of damage. For example, one can be completely torn the spinal cord, and then the interface needs to be a little different. Otherwise, sometimes the damage can be just a partial damage, so it's easier to repair that.
Right.
The first person that they treat was a 33-year-old person who had a partial spinal cord injury.
You said a partial spinal cord injury, and they were relatively young.
Yeah, very young. Yeah. Okay. And then this individual then was placed on this device, and the interface started to perform in a certain way that he initially started to walk. But then they discovered something else. If the information, instead to go directly to the nerves that they are exiting from the spinal cord, the information will go to the dura. And then the dura seems to be that when you have an injury, the body, just to protect and see if they can recover, because you see people that sometimes have an injury and then years after they recover.
Yes.
And then the people think that they just heal and that's it, okay?
And the dura is the thin membrane.
The dura is the membrane that covers all the nerves, okay? and covers the spinal cord.
Right.
They start to realize that the information that goes from the brain, if goes to the dura, will immediately irritate areas that they are giving information and behaving like a bypass. So even if the area of the injury require an interface there,
yes,
the interface can be done by going directly to the dura and irritating the dura.
Sure.
And if they do that, the next thing that happens is they irritate the dura and they put the patient walking 3 hours sessions of physical therapy for 40 days.
Wow. Okay.
And,
so intense.
Seems to be that wake up some communication that is on the dura to become like a bypass of the area where the injury was created.
Yes.
After the physical therapy, the people was able to walk almost normal, but then they switch off the instrument.
Yes.
And after they switch off the instrument, these people start to walk better. Then it seems to be that the communication from the brain to the dura is the way that should be done. Now we need to study how much of this will require just a very minimal electricity or a minimal type of interface to create that communication more realistic and easy. And if we can do that, probably we can create a bypass directly from the upper part of the dura that is damaged, cross the damaged area, and go to the dura below and put that communication there. And instead to be using a computer in the brain.
That's amazing that they can bypass the hurt areas and almost recreate, would you call it a nerve pathway or something that kind of resembles that?
Yeah, it's once you reactivate, the nerve will function like all the nerves function.
Right.
They receive the information, will act. And initially, I thought we would need to use crutches and things like that. But then after that extensive physical therapy, they reactivate the seems to be that they wake up this communication that exists in the body. You bypass the injury, then you can create a normal activities.
Truly amazing technology that's in the system today. Imagine being able to reactivate a pathway so that you are no longer paralyzed. Thank you for watching American Medicine Today. Check us out next week right here on Newsmax and anytime on our Rumble channel. If you have any comments or questions, contact us at the numbers below. Or you can tweet at Dr. Bonati using the hashtag American Medicine Today or hashtag AMT. And to catch previous episodes of American Medicine Today, search the Bonati Spine Institute on YouTube and Rumble.